We have high volume clinics, not only in adults and some geriatrics, but also pediatric clinics. We have 2 orthopedic surgeons that work in our department, and we work together. So there's this niche that a lot of programs don't have. We have exposure to newborns, club feet, and kids with cerebral palsy, and all kinds of different pediatric pathologies.
Residents, both the juniors, seniors, and the interns, we all work very well together, being able to kind of collaborate, share ideas, always ask for help. They're always there to help back you up.
I really like the way the curriculum is set up. I feel like as a first year, you get to dip your toes into other specialties. For example, you do internal medicine, vascular surgery. That kind of gives you an idea about how to work as a team to help patients and treat patients.
We rotate through several different specialties, dermatology, emergency medicine as well. Second year, we're in the operating room quite a bit as well as clinic, and that's where we're really refining these basic surgical skills.
And after that, as a third year, you kind of hone your skills as a foot and ankle surgeon. I think having that base by working with other teams help you really understand how healthcare works for patients and what is the best way to treat patients.
One of the unique things about this program is that we take a trip to Vietnam to provide surgery and also see patients in clinic. We do get to see a lot of different pathologies, a lot of pediatric cases, flat foot reconstructions, a lot of unique cases that we don't see here.
It's a large teaching hospital. We have students from Boston University, from Stanford. Most of the people in our program have been teaching for 20, 30 years, and they still haven't lost that spark, that interest, which actually is great.
The residents rotate through at Kaiser, Permanente, Fremont, San Leandro, as well as Santa Clara. We also have privileges at Forest, which is a day surgery center, where we're able to see more elective cases and be able to have more numbers in our surgical interventions.
Having gone through all of these different specialties, including vascular surgery, orthopedic surgery, emergency medicine, I've never just felt like a resident. I felt like a very important member of the team.
Kaiser Santa Clara has a lot of women surgeons and doctors. I wanted to have a role model to look up to, and really kind of motivates me to become like one of them, and I hope to become like one of them in the future for sure.
Learning is a lifelong process, and even after 20 some odd years, I still learn something every day. Our goal is to have our residents look back and say, yes, I did work hard, I learned a lot, but you know what, it was also fun.
We get stipends every year for gym memberships, as well as access to the gyms here as well. And we also have those resident fun days, where we have our most recent resident retreats, being able to kind of learn more about each other, see what we're like outside of the hospital setting. And then we also have the resident wellness days, where we get free treats, free goodies, things like bobas or ice creams.
They provide us with meals Monday through Friday. There's catered food, there's happy hour, you also get meal cards. So you're always well fed.
Knowing that in podiatry residency, it can be very difficult with the hours. You need a culture of people that you're comfortable around, and I really felt that here. I would say it's unbeatable.
These last 3 years have been some of the most challenging but most fun years of my life. I've had the honor of working with and being taught by some really talented and caring attendings who challenge me every day to become a better person. I can confidently say that at this point I feel very confident going out on my own.